you'll be able to download those slides as a PDF form if you want them. Awesome. So I think that is everything. We'll get started. So my name is Lucy Scott. I think a lot of you have joined me on webinars before, but if not, here's me. I am Veterinary Behaviour Services NZ, and I've got a really interesting logo here, which is Fear Free. So Fear Free Pets is fearfreepets.com. Go and look them up because they are a very useful website specifically for people with pets and helping them in the vet clinic. And there's also certifications for vets and vet nurses and support staff and groomers and trainers as well, actually, in fear-free handling. So that's a really interesting website that I would recommend you all check out. And a lot of the stuff that I'm talking about this evening would have come partly through there. So go and check that out. So who am I? So I am a veterinarian by trade. I have been a mixed practice veterinarian for 6 years, and then I decided to start veterinary behaviour services at the end of 2020. I still worked as a vet until June 2021, when I then did some exams in veterinary behaviour. Since then, I have been focusing completely on veterinary behaviour services, and I'm now working on behaviour problems of cats, dogs, horses. I'm based in the Waikato, and I go to Auckland and Tauranga and the Bay of Plenty as well. So, sorry, Waikato, Auckland and Tauranga, Bay of Plenty as well. So, yeah, if you have behaviour problems with your animals, please get in contact. I would be really keen to help you guys. So we're going to talk about this evening, how do we prepare our dogs for the vet clinic? Why do we do so? Things you can do before you even get to the vet clinic, things to bring with you, helpful skills that your dog, if you can teach your dog, will really make the vets and vet nurses and your dog's life and your life easier. What things can we prepare for? And we'll go a little bit into how, and recognizing fear, anxiety, and stress. So that's a really key thing. If we can recognize our canines' body language of anxiety and stress, we can help them and we can actually work through it. We're going to talk a bit about desensitization, cooperative care, and supplements and aids that might help your dogs through the vet visit as well. So why do we prepare our dogs? We are ultimately trying to avoid this next picture. So I found this in some fear-free slides, which is what we are trying to avoid. It's a funny cartoon, but honestly, that dog there, he is fighting for his life, in his opinion. So we're trying to avoid them feeling so stressed and anxious and fearful that they have to go to being aggressive. And we also would really we love it when our patients like coming into the vet clinic. I remember during lockdown and one of my patients walked past and wouldn't come away from the vet clinic door and was scratching at the vet clinic door to be let in. And we couldn't let him in, poor guy. So that is the kind of response that we want from our patients, is a positive, excited to be there response rather than a fearful response. And we are working as hard as we can to help you guys and your dogs to get there too. So things to bring when you're packing the car to come to the clinic. Collar or harness, whatever is your preference, whatever you walk your dog with normally, and a lead. I have many times had to go find a lead for people because they didn't bring them to the vet clinic, and it does make it a bit hard for them. They usually either carry the dog or they're holding the dog by its collar. Remember your lead. If not, the vet clinic should have many with there, but it's best to bring what your dog is most comfortable with. High value treats and cut into teeny tiny pieces. And if it's not too far from their breakfast or their dinner, actually bring their meal with you. And if they're a little bit hungry at the clinic, that actually is to our advantage. So being able to feed your dog their normal meal or something especially delicious. And I've got in the vet clinic would have peanut butter. I would have like wet food, dog roll. I've used, with some patients, I've used chicken, and I've used, with cats, I've also used like the Temptation squeezy tubes. They're quite useful. Remember your poo bags, because you're going to go to let them go to the toilet before they get in the car, and then between the car and the vet clinic. And that's quite important, because if they were quite anxious in the car, having that break will really help them bring down that arousal level. And mat, a lot of dogs aren't mat trained, and we're going to talk about that in a minute. But if you have their normal mat with them, it's amazing how useful that can be. So I use mats on the scales or in a crate if we have to put them in a kennel. If your dog knows they're on the bed, then that's a really useful skill to know. And so bringing their normal mat with you instead of one that we have is also quite good, because they recognize it and they know that that's their spot. If you have them, a halter, if you use them, that is, your dog has to be really comfortable wearing the halter for you to use it in the vet clinic. And the same with a fitting muzzle. I will talk about muzzle training later on this evening. On the way to the neck, make sure you have plenty of time so that you're not stressed as well. I recommend a restraint or a non-slip surface in the car. My dogs wear a harness. There's one of the clip that goes from there to the seat belt, and that is quite useful. It means that they can't, if we are in an accident, they're not going to hit you in the back of the seat or go flying through the window. Toilet before leaving and before going into the clinic. If your dog gets anxious or nauseous in the car, take note of that. We can talk to our vets about anti-nausea medications for car trips. So if you have a routine car trip, that is something that you can possibly have prescribed and help you with. If your dog gets particularly anxious in the car, make sure you've got extra time so that they can calm down between getting from the car to the vet clinic. And it's also something that you can work on later. Being aware of it means that we can then work on making them feel more comfortable about the car. So it's less of a trigger. When we've got multiple triggers that stack on top of each other, then we can go overboard. Right. In the waiting room, find some space. So find a space that's away from other animals, because some dogs don't like other dogs. Some cats tend not to like dogs. If they might like their own dog, but a strange dog in the vet clinic is going to stress them out quite a bit. So please make sure that your dog stays away from cats. I would find a corner, focus on rewarding some calm behavior. If you've got your mat with you, put the mat down and sit on the mat, and you can use your treats to reward them for being calm. This is a visual aid vest. I'll talk a little bit more about them later. I've got another example, which is really great if your dog doesn't like other dogs or doesn't like people touching them in the waiting room, and the waiting room is a stressful area for you. Something like this, you get them from roccoandco.co.nz. So they're a New Zealand company, and they provide these vests. They're really awesome. So please go look them up. There's lots of different options as well. So helpful cues for your dog to understand. So we've got sit, down, and paw, ones that are really commonly understand. And then we've got nose touch, go to mat, a chin rest, and muzzle wearing. So nose touch is when your dog touches their nose to your hand. So you're not putting your hand to their nose, they move their nose to touch your hand. And that sounds really simple, which is great, because if you're sat there and you want your dog to focus on you, you can ask them to do a simple nose touch. Like this, and reward them for each. You can keep their focus on you. The other thing is that it's useful at moving dogs around the clinic. So I use it, I put my hand in to go into a crate. I will use it to move a dog from one room to the next if they don't like being pulled on the lead. It's a really handy, useful behaviour. So if the vet nurse or vet knows that your dog knows that behaviour, show them, and that would be a really useful one for them to know about. Go to mat, as we discussed already, is a really useful because you can put that mat on the scales or in the kennel. It's a really useful one. And also, if they know that's their mat and they go to their mat and they settle on their mat, more likely to settle in a distracting environment. You will, going back to distractions, actually, it's a really good point. Whenever you say your cues might be great at home in the garden, but then you lose them when you're out and about, and it's because we've stepped up in distraction levels. So if you're losing your cues, if your dog doesn't understand them in the distracting area, then take it back and reward it more often. Take it back to a quiet place if you can, and then ask them again and reward them higher for it. And then you can build up the distraction and take it all as information. So I've got one dog that would listen to his cues most places, and another one that gets anxious and loses them. And I'm careful with him to reward him higher in those distracting environments. And over time, he's improving. Moving on to a chin rest. So a chin rest is when a dog puts their chin on your hand like this. And it's usually a duration behavior. So holds it on there. And I'll show you a really great video, hopefully technology, later of a dog that is using a chin rest behavior as a form of communication. So when he's uncomfortable, he lifts his nose, and when he's comfortable, he puts it back down again. And now we've got muzzle wearing, and I'm going to go into muzzle wearing in a bit more detail. So things we can prepare for in the vet clinic. So we've got body handling, holding their head, lifting their lips to look at their teeth, paw handling, so just you touching that dog's paw with your hands, restraint, so often we actually lean over a dog, wrap our arms around it and around their neck. Whether it's a big or a little dog, it's the same sort of feel. So that is something that you can do, you can practice at home. Being lifted up and putting on a table. The amount of dogs that as soon as you put them on the table, they feel really anxious. They're not used to being up here. This is completely unusual for them. I teach mice to jump up onto a table and then to jump off again, which is really useful, and they really find the table a really positive place. Standing onto the table and scales, leaning over them. Again, not just the restraint, but actually leaning over to listen to with the stethoscope. Pinching their scruff, that's actually something you can prepare for. And then we've got equipment, and I've put masks in because COVID, and we don't wear our masks at home, but it can be quite scary for dogs to go into a vet clinic. And not only are we in the vet clinic, but now these people are wearing masks as well. So being aware that is something that you can get them used to at home. I'm going to go into a little bit more detail. So I'm going to use two examples, the restraint one and also the equipment one. So we'll start with the equipment one. In this picture, you can see I've got a pair of clippers in my hand, and just above the clippers, unfortunately it's black, but I'm wearing a treat pouch, so there's food in there. So this dog actually is a little bit apprehensive about these clippers, but I'm holding them out to him. He's going to the clippers, and then I'm feeding him for interacting with the clippers. So he's choosing to interact with the clippers for a reward. And I don't push him. I go, you go to the clippers, you get food, and then I will slowly build it up. So I might actually have the clippers in this hand and touch him with the other hand. And then I might put the clippers behind my back actually and turn them on and feed him. So I'm rewarding for each step. So we can then put the clippers on his body, and then we can actually use the clippers if we want to. So we're getting him used to the clippers in a systematic way. We can do the same thing with restraint. So we can start by leaning over the dog, and then we stop and we give them some food. And then the next step, we would like lean over, touch their scruff area and one side, stop, feed them. So we're building up their tolerance. So the same thing with paw handling. So I might start at the shoulders, go down the leg, stop, feed. A little bit further down the leg, stop, feed. And this is a really good example because lots of dogs go move their paws away, right? So I don't want to reward that. I want to reward them for keeping their legs still. So if they do scratch their paws away, I go, oopsie, too far, and I go back to the shoulder and I reward them for keeping still and build up their tolerance. So being aware that all these things are actually really hard for our dogs. They've got as many nerves in their paws as we have in our hands, and they can be quite disturbing to a dog that, we're handling their faces and their ears and touching their paws. And if it was us, we would be wondering, well, where's the consent around? Like, what are you doing? So something to be aware of is that they get uncomfortable with those things as well. But although we can teach them that those things are normal and that they're not uncomfortable, and they come with positive things. So, muzzle wearing. Muzzles are not for bad dogs. Muzzles are not for bad dogs. Muzzles are for dogs that struggle with things. They are definitely for dogs that are prone to aggression because they prevent bites, absolutely. But muzzles are also for dogs that eat things that they shouldn't. Muzzles are also for dogs that are anxious about people and strangers. And it's a really clear signal to people when you're out on a walk not to go over and touch this dog. So muzzles are something that we use in the vet clinic a lot, but we don't actually prepare our dogs for. So it can be quite a stressful thing for dogs to wear a muzzle. And if they've never worn a muzzle before, and the first time we introduce it is in the vet clinic, that can really cause a lot of anxiety. So I recommend muzzle training because if you ever need it, it is one less thing that's stressful for your dogs. So for example, if my dog broke his leg, he would be comfortable wearing a muzzle so that I could lift him into the car without being worried that he's going to bite me in pain, because it's a natural response. He's painful. I understand that it could be quite painful when I lift him, but I have no choice. But if he's wearing a muzzle and he's comfortable wearing a muzzle, it's less of a stress for both of us. So we're going to make muzzles good things. So muzzleupproject.com. Please write that down if you're interested in knowing how to fit a muzzle, how to introduce a muzzle, how to make a muzzle a really, really good thing for your dog. I would totally recommend that website. So we break it down like we're doing with the body handling, right? So we create a positive association with the muzzle appearing, and then we reward them for approaching the muzzle, and then we teach them to put their nose in. So they tend to, as if you're rewarding them for interacting with the muzzle, they tend to put their nose in there. And then we hold it a bit longer, so we increase the duration. We teach them to eat through the muzzle holes because it's actually really, that's a bit of a skill that they have to learn. We're going to take it away, actually just do the clasp noise. So do the clasp noise and feed them. It's because the clasp can be quite a loud noise in their ears. So if we've gone, imagine it would be quite a big step between, I'm comfortable with my head in this thing, and then suddenly a noise, to be aware that that is something they can struggle with. I then clasp it around their neck, and then I go all together, you would put your nose in, and then I make a huge, great big deal, take it off straight away, reward them highly. And then our next step is to increase the duration that they stay in it. So traditionally, muzzles were we only use them in the vet clinic, we put them on, we take them off once the bad thing's finished. But if we can make the muzzle a really positive thing, then it is a really less stressful situation for our dogs to be in. Right, I have actually got a little break here for questions before we move on. Just need a drink of water. So please, if you've got any questions, pop them in the question and answer area. We'll have a bit of a break and then we'll move on afterwards. And I know there's a little bit of lag time, so I will wait for you guys if you want to put questions in. Great question. So our first question from Bev Edwards is, you do lots of rewarding. How do I do that if the dog is on a diet? Great question. So going back to breakfast and dinner, right? So I actually ration out. If he is on a diet, then we ration out the amount of food that he's going to have throughout the day, and we use that as part of the food in the clinic. If you have a, cheat day, and it's because we're going to the vet clinic, I approve of your cheat day. The fact that, yes, we're on a diet, but we also want to, we really want to make this a positive experience for them. So depends on how tight a diet we are on. I'll answer so that I've answered that. Cool. Deborah Sampson, do you prefer certain muzzles or is it variable depending on shape of face? It is variable depending on shape of face, but I do prefer basket muzzles because they're able to pant and they're able to drink and you are able to feed them through it. We use the cloth muzzles in the vet clinic for temporary restraint. So they are just for temporary restraint, but the dog can actually still nip through them. So we do have to be very careful. The Baskerville muzzles are pretty good, but they're usually specific to a face shape. You can get custom muzzles made here in New Zealand. Go to Kiwi Canine if your dog is going to be in a muzzle a lot. So that is something that you should consider, because if we can make them comfortable in the muzzle, and then that's all positive to everybody. There is something in the chat. Oh, Deborah, you put it in there as well. Righty. I have one last drink and then we'll move on. Awesome. So, you guys might think this is a strange thing to be including in here, but preparing your dog for the vet clinic is also about recognizing of fear, anxiety, and stress. So fear, anxiety, and stress in the vet clinic, you are your dog's biggest advocate. We are picking up on these body language signs too. If you would like, I did a body language webinar a few months back. It's on YouTube, it's on Facebook, somebody else. Oh, it's also on my website. So if you want to know more about the subtleties of canine body language, I'll direct you to there. But in the meantime, I want to talk about fear, anxiety, and stress in the vet clinic so that we can recognize it when we know that the dog is not, so that we know our dogs are uncomfortable. So we want our dogs to be in the green area, ideally. So perhaps just mild and subtle signs, but being able to recognize those. And we'll talk about displacement behaviors in just a second as well. So I'm going to start in the yellow area. So if you're noticing your dog's got ears slightly back or to the side, their tail is down, but it's not completely like tucked, like clamped down. They might have a furrowed brow. They might have either really slow or fidgety. My dog will do this thing where he's a little anxious and he'll come up to me and go for attention. Panting with a slightly tighter mouth, moderate pupil dilation, so the pupils of the eyes are slightly dilated. So that's the first. I imagine most dogs will be slightly out of their comfort zone, so I expect to see the level 1. If we're going up to 2, I'm okay, your dog's a little bit stressed, we'll back off a little. We then move on to turning the head away, might take treats roughly, or might start to refuse treats for a few moments. They'll still take the treats, but it's a little bit, I'm not 100% sure. They're not avoiding us, but they're also a little hesitant to interact, right? So then we're moving up to either flight, so their ears back, tail tucked, try to move away, trying to slink off into the corner, mouth closed, really clamped really tight, or panting. And then they're showing the whites of their eyes, which is called whale eye. And then we also have the freeze response, so tonic, immobility. A lot of times we go, oh, he's so good at the vet clinic. He just sits there. But if you're watching, his body is hunched. He's actually really uncomfortable, and he might even be trembling. And then we have severe signs. So fight, flight, not flight. Flight was our lower level, actually. Fight or aggression. So we've either got offensive, so actually coming at us, trying to say, I'm going to bite you, or defensive, so they're backing off into the corner, but they're showing warning signs that I am going to snap if you come any closer. We see, at the end of the day in the vet clinic, I see this entire spectrum go up and down it like all day. So it's really interesting to make sure that we recognize those things. As dog owners, it's awesome to be able to recognize those things in general, but in the vet clinic specific context, if you have a dog that's scared in the vet clinic and you want to actually make it more comfortable, we need to be really careful and notice those levels down below, those yellow signs, because that is at the level that where our desensitizing isn't going to work. We have to get back to the green for us to be, for the dog to be comfortable to be able to learn. Right. That was a long slide. So displacement signals. I'd like you guys to recognize these. So displacement signals are those that are out of context. So we've all seen the dog shaking like it came out of water. Well, that's actually a displacement signal. Often it's after something stressful. So I've seen it many a time when I take a dog's temperature, and then a few seconds later it walks away and it goes, because it's shaking off the tension, it's taking off the stress. Lip licking, scratching the floor, sniffing, and yawning as well. So those on the left are the signs, but these on the bottom are often the causes. So either tiredness, yes, but also overwhelm, stress, over-arousal, and responses to pressures. So you've seen a dog that's being pulled by its collar, and often it's showing signs like it's lip licking, which show little signs of anxiety. So, and then last bit in this part is the ladder to aggression. So this is a really great diagram of showing you the levels. So usually we start in these bottom levels, and these are the first signs that the dog's uncomfortable. I shared a video lately of kids and dogs, and often they're showing these signs of yawning, lip licking, licking their nose, turning their heads away, saying, I'm actually really uncomfortable and I don't want to be in this child's space. And we need to recognize those as signs the dog's uncomfortable, because they can escalate. So we've got yawning, blinking, nose licking, turning the head away, turning the body away, and then with one paw up, moving away, creeping with their ears back and their tails starting to be tucked under, and then crouched with the tail tucked under. And this one, lying down with a leg up. Now, we've all seen the dog that says, belly rubs. It's a very different body language to this, which is on their side with the one leg up, showing their belly, but it's actually a please don't hurt me signal. So there's a very different tension in the body language of the dog that is actually showing this appeasement signal, often showing the whites of their eyes and doing that lip licking as well. And then we have stiffening. Staring. So dogs freeze when they're about to, that is, freeze to them is a very clear back off now. And then we have growling, snapping, and biting. So I've put in here, please don't punish a warning signal. I used to do it myself. I have often seen an owner telling a dog off for growling. Now, we don't tell off a dog for growling because then the next time it won't growl and it won't show us that warning signal, and it will skip. So it will skip that growl and go from that stiffen to straight to a snap. And so they can escalate the aggression, because last time they growled, they actually got told off for that growl. So they're not going to use that, because not only did it not give me the space I needed, it was also punished. So being aware that dogs' communication signals shouldn't be punished, that actually should be listened to. It's a really key thing for us and our dogs' relationship in general. Right. So what if my dog's already scared of the clinic? So there are some tools we can use. So talking to your vet prior to the visit, they might increase time for your consults, so we're not as rushed. 15 minutes to get a dog in, do a physical exam, and give it a vaccination for some dogs just isn't going to happen. That is not enough time. But if we know prior, we might be able to give you some more time. Saying that, vet clinics all over the country at the moment are very, very pushed for time. And so if it is a routine visit, try and be flexible with time so that our vets can do the best they can with the limited vets and the limited time that we have at the moment. So they might suggest that your dog goes straight from the car, or from the toilet, in fact, and into the consult room. So they don't have to wait in the waiting room, because the waiting room can be quite stressful for a lot of dogs. Other dogs in there, people moving around all the place. It's all of these multiple strangers with masks on at the moment. And then perhaps ask them about discussing a pre-visit medication or anxiolytic. There are quite a few options now for us to give dogs before they come to the vet clinic to help them. I would suggest talking to your vet, of course, because you need to have seen them regularly within the past 6 months or something for them to prescribe, and they need to know that it isn't going to be a drug. So it's very case dependent. And then we have desensitization. So a technique in which the subject is kept below threshold and exposed to fears and an increasing hierarchy of intensity. Wow, that was jargony. What that means. So we keep the subject, the dog, comfortable at all times, and then we slowly expose them to the things that they're scared of. So they have to be completely comfortable for desensitization to work. We can also use food to try and change them from a negative emotional state to a positive emotional state. There's a great picture that I didn't put in, I'm afraid, so I should have done, of a lady with a bucket of ice cream sat staring into a cage where a spider is. And she'd started way on the other side of the room and slowly had gotten closer to the spider herself. And she had been eating the ice cream whenever the spider moved. And that's how we change phobias. That's how we help people cope with things that they're scared of. And the same thing with the vet clinic. So if you notice that your dog can't walk past the vet clinic even without looking at it and go, oh, I don't know about that place. We're not going in there, are we? That's a space that you'd actually take it to leave even a little bit further away. So we're going to have dogs trialing and walking up and down on the pavement on the other side of the road. And that's right, is you've got to take it to that place where they're comfortable, get them comfortable there and slowly move them closer. So one day you might just walk back and forth across the pavement, and then you might come a little bit closer, give them a treat, move away. The next day, you're going to go back to the same space, but you're going to move closer, quicker. And then you might get a little bit further, get them a treat, get them away. This time, the third day, we're going to get to the door. We're going to touch the door. We're going to give them a huge reward and move them away. Eventually, you'll be able to get them in the door, into the waiting room, so they're a lot more comfortable. But that does take time, because we're trying to change an entire emotion response of fear. So being able to understand that we go at the dog space and we just systematically go, you can do it, mate, it's okay. Here, have a treat for doing that. I do a lot of desensitizing to a lot of different things, noises, being separated from humans. I do to strangers. I'm the perfect stranger. I come with lots of treats and I stay at a distance so the dog is comfortable and throw the treats until the dog is comfortable. If you're struggling, get some professional help with desensitization programs, because they are really specific to your dog and your situation and the fears that he has. And if you aren't recognizing those signs of anxiety, then in fact we can sensitize them to it and make it worse. So being aware of that is something that you might need some help with. But yeah, that is how we would get your dog comfortable again with the vet clinic. And the same thing goes with things like clippers or handling of paws. We do it at a level that they're comfortable at and slowly build it up. So I've got 2 more slides. I've got supplements and other aids, and then we've got cooperative care. So I will moving on to supplements. So supplements and other aids, there are a few here in New Zealand. So thunder shirts. So our little Jack Russell on the bottom left here is in a thunder shirt. It's a compressive shirt. We can do a DIY compressive wrap, which is a scarf essentially that goes around the chest, over the back, underneath their belly. So it's a compression like a blanket, like a weighted blanket. It has a bit of research that says it can help in some forms of anxiety. So that is a possible. If it works for your dog, take care. It's got Velcro. So if your dog doesn't like the sound of Velcro, it's something you're going to have to get them used to first. And then I've put visual aid vests. I'm a really big fan of visual aids vests for dogs because it really helps other people recognize and understand your situation. So again, in the waiting room, if you've got no pets, I'm nervous, you're not going to have people coming up to go, oh, what a cute doggy. Right. And then I've got Adaptil. So Adaptil is a dog appeasing pheromone. So dog appeasing pheromone is a smell that only dogs can smell. So pheromones are species specific. And it comes from between the mammary glands of the mother. So it is synthesized by us and it comes in a spray, collar, and a diffuser. So the spray is good because if you have one of those visual aid vests or bandanas, you can spray it onto it. The collar is great, but it lasts a month. And the diffuser is for a building. So we use them in the vet clinic. If you've got the spray, just in mind, just a point, it's got an alcohol base in it, which is quite aversive. So you put it on, let the alcohol evaporate for 15 minutes, shake it around. Be aware that if you put it on straight away, that can be a bit strong. Excuse me. Carmex is a supplement that has tryptophan in it. Sorry, I lost my train of thought. Tryptophan is the precursor of serotonin, the neurotransmitter that is associated with calm and happiness and satisfaction. So that is something that you can buy over the counter at the vet clinic and online. So that is something I could recommend. Then we have cooperative care. So I've got 2 links here. The second one, which is for you in the slides, is to a book. So Cooperative Care by a lady called Deb Jones. And what the book is about how to help your dog with all those husbandry and things at home and then in the vet clinic as well. So it's about teaching them how to have their paws handled, look in their ears, those are the first 2 that go. Eye drops is a good one as well. So, and then this video is of a very clever piece of training. So this isn't something that I'm expecting you guys to be able to train in a single session for sure. So what it is a dog that is chin resting like this while they do a blood draw. So the dog, you might notice the trainer sometimes says pause, and what that's happened there is the dog's actually lifted its chin. So when she says pause, she's actually talking to the vet tech. So the vet tech is pausing because the dog's a little uncomfortable, and then it puts its chin back on for her to, and she says, okay, continue. So we'll watch that, hopefully.
Good job, baby. It's your girl. It's your girl. Okay. Yes. And then if you want to go ahead and walk down his body. Oh, great. Go. Yes. Pause. Yes. Good job. Go. Real. You look good. Cheese after this. You're so smart. There's your blood. You shift your body back just a little bit. Perfect. Look at you, baby. Look at you. Doing so good. There's your blood. There's your blood. Mama's so proud. Pause. Keep going. You're doing great. Yeah, you're doing great. Yes. Good boy. Stay in position right there, please. Right. Yes. You see her? Yes, you're doing so good. Yeah. Yes. Stay right where you're at. Beautiful. Beautiful. Yes. And then go ahead and do another tactile down. Okay. Go. Pause. Go. And pause. Yes. Excellent job. We got your blood. Come on here.
You did so well.
You did so well. That was excellent.
Good boy, Sonny. You did so good.
She's got some treats for
You
you.
did so good. Do I get to give you some?
He's like, I don't know.
Good boy.
Good job, buddy. You got your
And
blood.
everybody celebrates.
Good
Right.
job.
Boy, Sonny.
Let's go back to our slides. Right, so I'm seriously, I really love teaching cooperative care. So being able to do those sort of things without any restraint is really life-changing for a lot of dogs and humans as well that are associated with them. So I've taught people to be able to, you notice that there was a muzzle in her lap as well. So that, so being able to actually put his nose clearly into the muzzle. So I have helped people work through severe, like absolute can't be touched from the vet clinic to be able to give them a subcut injection. And so that is a really big passion of mine, teaching and learning about cooperative care. So if you want to learn more about that, I'm your lady. Right. So a little bit before we get into questions and answers. So how can we work together? So as a veterinary behaviourist, these are my services. So I do phone consultations, in-person behaviour consultations in the Waikato, Bay Plenty, and sometimes Auckland, and Zoom-based behaviour consults. That's been awesome. So I've helped people in Wellington, Southland, and I just did one in the Hawke's Bay as well. So being able to help people a little bit further away from me has been really valuable. And then I also do this one-on-one training and coaching, which is often about a behavior that is a simple behavior, and the people need some help learning how to train their own dog, or it's something like this cooperative care training. So if you want to reach out to me, you can find my website, send me an email. Oh, I've also got, these are the upcoming webinars after this one. So I'm doing, every month I'm doing a webinar. Sometimes it's for professionals and sometimes it's for the public. So the aggressive dog at the vet clinic and the aggressive cat at the vet clinic, those are both for professionals. So tell your vet. And also the preparing your cat for the vet clinic and the 10 biggest behavior myths for all animal lovers, those are free ones and they're open to the public. So pop that in your calendar, and if you are subscribed to me through my newsletter or on Facebook, you will get a reminder and telling you that those are coming up. So yeah, come and join us. And my last slide is any questions, and it's also got my contact details. Lastly, also I have, since you guys are registered, my phone consultations are usually $80, but for the webinar, I am doing a $50 offer. So if you're registered for the webinar, you're watching this now on the replay, you can get this link, and I'll also send it in an email as well. So you're welcome to click there, find a time to chat to me, and we will go back and do any questions and answers. Oh, I'm glad you all loved the video, the liquid cheese. I know we don't really have the squirty cheese. Do you know what it is good though? You know, the baby food pouches, is if we fill those up with they actually do like baby food too, some of them, but something like meaty pouch, that actually means it squeezes quite nicely. And if you've got a grub dog and a muzzle, you can actually squeeze it in through the muzzle to squeeze it in. Yeah. Awesome question and answers. Okay. So Caroline, I've got a horse question here, and it is actually relevant, right? So it's about being anxious about having his feet handled and needs to see the farrier. So that's the hoof trimmer. So is a mild sedative paste out of the question as an interim option? That depends. If he does need to be seen by a vet, they need to check that he hasn't got a heart murmur. Depending on what the vet has on hand, sedatives can be quite useful in the interim, partly because they actually can reduce learning in that moment. So we can actually push through it a little bit more and then go back later and train the hoof handling, which is what you're going to be doing, which is fantastic. But perhaps, talking to your vet about a sedative. Sometimes the oral sedatives, sometimes they actually, because they're too anxious, they can actually throw them off. So which is why injectable sedatives are better. Good question anyway. I know it wasn't dog related, but I'm glad that you asked the question. Angie, any recommendations for measuring for a muzzle if you can't put a tape measure near the dog's face? Can we put anything near the dog's face? Can we put like a piece of string, or can we use your hand to measure it? That's actually quite a good one. So if you can get your hand next to it and go, here's this far, or around the head. So that's around the back of the head, and go to the muzzle. Then I mark it with my fingernail and I walk away. That's actually not a bad one. Bev Edwards, the spectrum chart official. So I'm not sure which spectrum chart. So I've got the ladder to aggression, which was, I can't remember her name, but she is a veterinary behaviourist in the UK. I actually watched a lecture by her the other day, and I'm afraid I don't remember her name. I'm sorry. And then the Fear-Free Pets one, that was so the FAS scale with the color coordinated one. So that was that's via Fear-Free Pets. Yes, excellent blood collection. They did a really great job. It was a really good team job. Hey, I really enjoyed watching that video, and I would like us to be moving towards that in general. Lisa van der Beek, would you recommend any veterinarians in Southland or Queenstown region that would be open to work with this much patients? Unfortunately, I don't know many in Southland or Queenstown. But working with patients, actually, once we realize that it's faster, then actually you will slowly get people, we'll get more vets on board with this. I've got one dog that has always been fantastic at the vet, but if I rushed him, he would not cope at all. So I think I've been very patient with him, and that means that I can do. He will literally just sit still and hold while we take blood for transfusion for another dog. We're very lucky with him, and he's more tolerant than most. And so just bearing in mind that the dog's tolerance levels as well matter. As to veterinarians, ask around, keep asking. Say, look, I really want to work with you guys. I want to show you, send them the video. It's on YouTube and the links in those slides. Most of my vet colleagues that I know and work with directly are all really keen to work like this. Yeah. Great. Thank you, guys. No, Caroline, don't worry for the lack of a dog-related question. The Fear Free Pets also does cats and horses. So it's, yeah, although this is actually all relevant to every species. I've just made it dog specific this evening. You are welcome. Do you suggest booking a double consult to allow time? It depends on your animal and the vet and what is needed. So if it's a routine vaccination, depends. I've done 30-minute routine consultation vaccinations with dogs that needed that extra time and that extra patience. Yeah, absolutely. Talk to your vet. Absolutely. You guys are very, very welcome. Have you got any more questions for me before we head off this evening? I really enjoyed putting this one together for you all. I will wait a few seconds more because I know there's quite a big lag. So yeah, actually that's a very good point. Lindsay said, Lisa Vanderbeek, you could contact Erin Jones at Merit Dog Project. She's based in Christchurch and uses cooperative care practices. Talking to veterinary, to trainers as well. Go to trainers and go, look, I'm interested in cooperative care. Do you know what that is? Can you help me train it? We've got some really fantastic positive reinforcement trainers here in New Zealand that are doing these things. Yeah, that could be, that it would be a really good place to start. Lindsay, again, veterinary practices, that is. She might know of a few places to go to you. Cool. Yep, no, great. You guys are having a conversation about that. So Carmex is a supplement more specific for occasions, or they could be used in general to take an edge off an anxious dog. Yes, and in fact, actually, so tryptophan is also in the Calm diet. So that could be something longer term that would be less expensive, I think. Or there's actual medications, anxiolytics that work on serotonin as well. And Deborah, you didn't mention calming probiotics, or you might have, as I arrived late. Yep, no, I did not. So calming probiotics, there hasn't been as much of it in New Zealand just yet. It's just really arrived, and I'm not quite sure how quickly it works as well. But that might be great for a dog with long-term anxiety. Yeah, I haven't tried it yet. Tell me if you have. Awesome. Any tips on urinating or marking in a clinic? My biggest tip would be making sure that they've gone to the toilet before they've gone in. And then if it's an entire male, I'm afraid that that is a natural behavior that we deal with every day in the vet clinic. So yeah, that is a hard one. They're often not likely to lift a leg if they're feeling anxious. So that's good to know, right? Anything else before we head off this evening? I gave us an extra 15 minutes to see if there was extra questions. Awesome. Some really great questions. Thank you, guys. I like it when the audience is sending me questions too. Alrighty, I haven't had any more pop up, so I'm going to head off this evening. Thank you all for coming, and yeah, if you so Sarah says I'm going to read that out. Thank you. Vet knows here, so it's nice to see. So you see anxious and fearful pets all the time in the vet clinic, especially with the current times. I know masks and COVID have a lot to answer for. So I think this webinar has been great for dog owners to learn how they can help prepare their dogs for the vet clinics. Thank you very much. If you're interested in more of this fear-free stuff, Sarah, so Fear-Free Pets is somewhere that I would go to for some CPD. It's been fantastic. Thank you all so much for joining us this evening. I'm going to head on off now. I will talk to you guys if you need to be. I will send out an email tomorrow with the replay. I'll also have the $50 phone consult offer, and it's got a little questionnaire in there. So the questionnaire, if you answer the questionnaire, you can be in to win a couple of training sessions with me. Alrighty, guys, we will talk to you later.